I would have never dreamed that I would meet Joe and we would put a project together of this kind. It's very unique, but it brought us together because each of us had an interest in doing something good for the community.
At that time, there were sort of like two standards of care. One was urban hospital and rural hospital. I felt that there should never be a double standard of care.
I first became interested in the hospital property because Dr. Lillestrand owned it in conjunction with his clinic, Frank Clinic. He wanted to sell it. The clinic wanted to sell the properties. And I knew nothing about medical facilities, particularly a hospital. But I'm always interested in good property. And this was adjacent the shopping center.
Leeward area was growing so fast, and when people had medical problems, they had to go all the way into Honolulu. We didn't have the freeway system, so it took a good hour and a half to get to the hospital, especially when the traffic was heavy.
There wasn't resistance from the community. There was resistance from the state of Hawaii and their healthcare organizations because they focus on cost. And if you build too many hospital beds in a community, that cost is borne by the state of Hawaii in their healthcare program.
You have to get approval from SHPDA, the State Health Department. We had to meet with three divisions. One was West Oahu, Central Oahu, and finally the state board. All three boards, no matter what our presentation was, they unanimously disapproved the hospital. So I started a drive of petition, and every week I got hundreds of petitions by the people of the living in that area. And I mailed the list of petitions to Mr. Harry Thompson, who was the head of the SHPDA department, and I mailed it to all the governor, the mayor, all the council people, politicians, every week until we gathered over 13,000 petitions. That took several months. I think Harry Thompson was not only tired of looking at all the lists that he got, but he was impressed. I used to call him up each week, and one evening, after our conversation, he said, "Don't worry, you're going to get the hospital."
We were fortunate to find Healthcare International. They were out of Austin, Texas. So they are actually in business in Hawaii when I was introduced to them. You know, their model that they had was more like a hotel operation as opposed to what traditionally has been the hospital operation in Honolulu. And they designed single patient rooms. And they were large enough, these rooms, to accommodate a family to join the patient who was in the hospital.
They even hired a hotel specialist as one of the top person to make sure that people were treated like guests. And they even had ideas of serving gourmet meals.
This was a very good business decision on their part because they needed to compete successfully with doctors who wanted to send their patients to the downtown Honolulu hospitals.
I told them that you should check your ledger. I'll guarantee you that over 1/3 of your patients are coming from the Leeward area. And if you don't move in, I'm going to find somebody else to come in here. And you're going to lose all those patients. I'm going to find somebody just as good as you or better than you. When Pearl City Medical decided to move in, then we had no trouble. They all decided either to come there, practice part-time, or get another partner to serve that area. Within a month after we moved in, we were able to fill the MOB.
When we finalized the design with Healthcare International, the operations of both towers were so integrated with their foundation and parking and all the utilities that a facility like that requires. I agreed with Healthcare International to sell my interest in the physician's office tower to them so they could develop the entire medical campus.
$120 million for 120 beds. It's $1 million bed.
Yeah.
That's just quite, and I don't think no one's going to build a structure or facility in that scale anymore.
I would agree with that.
You notice that after the hospital came up, people found out what was there. The hospitals in town started renovating the hospital, improving the facility. So, as stated, it improved the standard of care for all the people in the state of Hawaii.
And we're very proud of that, aren't we?
Well, yes, we are.
Thank you.